Now, once we have diagnosed a case of recurrent patellar dislocation, then we come to the treatment of it. Once before we have made all the history examination along with the radiological investigations as well, to make it sure that what is the cause of the recurrent patellar dislocation. Initial treatment, with whether it's a recurrent or it's acute dislocation, usually in case of acute, the initial treatment is always close reduction, followed up by either you give POP or you give brace for a few weeks, and then you give muscular strengthening exercises for over the long period of time. Initial treatment for the recurrent chronic dislocation is almost similar, which involves actually the mainly the knee brace, that you need to give the patient a knee brace for a few weeks to maybe 4 to 6 weeks time, so that by that time it actually helps in the healing of the soft tissue. Therefore, once the healing of the soft tissue has occurred, then you can ask the patient to go for strengthening exercises, especially the quadriceps strengthening exercises, along with the hamstring as well as the quadriceps strengthening exercises. But what you need to remember is that if this may be associated with increased hematoma or increased swelling around the knee joint, there may be associated pain as well. Therefore, if that is the case, may also give analgesia, like in form of NSAIDs can be given. And if the hematorosis is quite large and it's actually quite tense, and there is always a chance or suspicion of development of compartment syndrome, then we can also aspirate the hematorosis as well. But that is usually rarely done. Mainstay of all this treatment in case of initial treatment of chronic recurrent patellar dislocation is always that you give knee brace along with the NSAIDs, so that once the patient's acute symptoms settle down, soft tissue has healed over periods of 4 to 6 weeks, then you start the quadricep and ham strengthening exercises. And the mainstay is always the quadricep and ham strengthening exercises. In the case of, it is the most common, most important non-operative treatment of the recurrent patellar dislocation.